Good day to everyone. This is Kim Kinsley Noval, a BSN3 student of St. Paul College Foundation Incorporated, and I'm going to do a return demonstration. What you want to do is to check the chart for an order. You also want to check for allergies, specifically latex. You also want to look and see if there is any contraindications why we should not be suctioning the person, like a nose or a mouth or a throat injury. Okay, once you establish that, then you can take and come out and you can wash your hands and gather all your equipment from down to the room. Usually we wear face shield with high protection when we're suctioning. Once you come inside a room, you must identify your resident, explain who I am and what I am here to do. She agreed, and we've established the mood of communication while I'm actually doing a tap on the bed. I would also provide privacy because it's not something that you want someone to see what you've done. If you feel the need to wash your hands, feel free to do so. Now we have our saline here, and if it's a new bottle, you could open it up and you do not have to lip it. But we're gonna say that this bottle is a bottle that's been opened but less than 30 days, so I'm gonna use my lid upside down and I'm gonna lip my saline like syrup or honey and pushes the organisms off the outer edge here. So set that there. Open up your water lubricant, not oil, water lubricant that we might need. And since I didn't have to listen to her auscultate her lungs because I can hear her gargling, I'm gonna put my stethoscope to the side. Make sure that your table is clean and dry. Now the cup is lying partly over here on the contaminated part. You want to pick that up on the side, wash it together, and until you can establish which is inside and which is out. Just stay to the side. So here's the bottle here, the top, and now I'm just gonna set this down. I'm gonna put it over here and I'm gonna need it to rinse my catheter. And notice I'm not going over my field, I'm going away from my field. Label is in my palm, so if the label is not waterproof, the label won't smudge. And you can go ahead and put your lid back on. Now we're going to turn our suction on. This particle model we have 80 to 120 is your medium suction, and we're gonna need it to in continuous because we will get down. We wanna go ahead and suction out. Go ahead and open up this little slit here to put your fingers under to open up, and that's your 1-inch margin here. Okay, just crease your paper back to the side so to stay open. So our inch is contaminated. 1 inch is contaminated where I can touch, the rest is not. Now she is still doing fine. I do what I call reality check. I go to my saline ready. I got my suction on. My surgical tube is here, so looks like we're ready to go. 1-inch margin, I can put my finger in. I'm gonna reach in and pick up my gloves, step back off my field and sew ahead and put my hands in, and notice I keep my hands above my waist. Now this one I'm gonna touch here, and once I'm actually ready to put my hand in it, I'm gonna duck my thumb. And again, I'm gonna step off my field so that I won't contaminate anything. And sometimes the gloves won't always go on the way you want them to. You may have to start to sort your finger out. Now before I do anything else, again, I wanna look and make sure I got everything that I see. Now the suction catheter. Right now, the whole suction catheter is sterile. Once you actually Connect the surgical tube into it and touch here the pink part, and back is not gonna be sterile. So make sure you got what you want. Now I'm gonna go ahead because I may need some lubricant, and I'm just putting it in this part here because that is not waterproof. Just put it in your water first. Just lubricate about an inch or an inch and a half. Now we're gonna go down, and she just told me this was the better side. Once I go down, there is a couple things that happen. I have to go in and go out for 10 seconds, and do not put suction on until I start out. And when I start out, I do not intermittent suction, and I parallel twist this back and forth. So here we go, going down, down, down. She's coughing and now suctioning, and I'm twirling this as I come out. Now you need to keep this sterile, and then take this hand if you don't have a monitor to check her pulse, because you want to make sure and know that she's fine. So she looks like she's doing fine. We are sure to put her oxygen back on. Just keep her calm, talking to her. Now when she gets settled down again, you want to suction out all the secretions that's left in here. Keep this sterile because she still is conjuncted. You want to wait 1 minute and then go back in and suction out again. Never suction more than 2 times. So she looks alright. She said she thinks that she has a little bit more down there. Heart rate's good. I didn't have a pulse ox on, so I have to check on it later. Start relying on skin color, capillary reflex, and have her breathe while talking to you. Now I'm gonna go back down and move time again my fingers off the suction, and I get all the way down in parallel and contaminate section from now. The thing to notice too is my hand never touches for more. It's close, but I won't touch it because if I did, my hand will be contaminated. So one more time, going in again, roll around your hand, keeping it sterile. Talk to her, reassure her, check her pulse, look at her skin color, and get her to take slow, deep breaths. In times, you have to talk them down and get them to relax. Because not only are we suctioning out secretions, but we're suctioning out their oxygen. When we do that, so reassure them, she's sounding better, she thinks she's doing good. Suction all the secretions out, and this will be wrapped around your hand. Now your glove over top of it, and that way all the secretions are contained in it. All of this get wrapped up and get discarded. Now we can turn the suction off. Make sure she's comfortable and okay, but put everything back the way it was placed before I came in. And now I wash my hands and go and document.